what I would really like to know from you, because I personally also use a lot of bowel nosodes in my practice,
Hmm.
and I know that you also use it in a very interesting way, and I know that you could often use it quite frequently with frequent repetitions, quite opposite to how it's actually written in the text. And I found the same. I also often nowadays use it in ascending potencies, like 30, 200, 1M, with quite a interesting results. And it would be great for us to know a little bit just before you go about your experiences with bowel nosodes, and especially in autoimmune diseases. How is it?
Okay.
Which are the remedies you're seeing more often? For example, I use a lot of psychotic compound.
Yes,
It comes very
psychotic.
often. Or
Absolutely. Psychotico is one of our, out of all of them, it's probably the one that has most joint disorder in it. But the bowel
Mm,
nosodes are such fantastic remedies. I love them, as you know. I lecture about them
mm, mm,
extensively,
mm,
both the large ones and the small ones. And I find them so helpful because, they say get the center right. A lot of our immunity is mediated via the gut. Our levels of toxicity, how we absorb we need to get the gut right, or nothing will be right.
mm,
And we live in such a toxic world, and often people, I see babies that have been given antibiotics the minute they're born,
mm,
regularly. So we need to make sure that the microbiome is good. We're now seeing how much of autoimmune disorders is affected by the gut. All sorts of things. Even Alzheimer's and Parkinson's are now thought to be problems from
mm,
bacteria in the gut ascending from the afferent neurons on the vagus nerve. So we need to get the gut right. But regarding joints, I use it a lot for joint problems. I've recently had great success with Morgan Gertner in a very
mm,
severe psoriatic arthritis case.
mm,
Um, I have used Psychotic Co lots and lots
mm.
of times. The Psychotic Co looks very like Thuya. You could, they're very hard to
Exactly.
differentiate.
Mm.
Um,
Although interestingly, psychotic compound, if you see the rubrics, has so many interesting rubrics of jealousy, appreciation, sibling rivalry, and sometimes also has a shade of calcareous self in that matter. Of course, it's a complementary to Thuja, but I was just wanting to know, how do you use it, and what are the potencies you use it, and
okay.
your experiences.
I mean, I think we all find what works best for us in terms of potencies. For me, I like using the bowel nosodes initially in a 30C for 21 days. Now,
Mhm.
I will ask people to call me if they have any major changes in case I want them to stop the
Mm.
the dose or to continue with the dose once I've spoken to them. But what I find, it's a bit, I think, in a different way, like an antibiotic, we're told don't stop it too soon because the bacteria will regrow. We're trying to change some bad bacteria, reimpose a better microbiome. And the feeling again is that it can take a bit of time. So I quite like giving it for 21 days. And it's very rare that I get any aggravations or problems that require somebody to call me and say, okay, let's stop and wait. So I often give it in a 30C for 21 days, and then we'll let it work. I find that the bowel nosodes work deeply and for quite a long time. So I may not give them another remedy for 3 weeks
And
after.
no, not higher potencies, like for example 200, 1M, 10M.
Yeah,
For
quite
example, I
often.
I use a lot of dysentery compound in 10M as
Yeah.
actually a constitutional remedy also. What
Fantastic. I
is
mean,
your
there's
experience?
no reason at all why you shouldn't. And what, I do, but I tend to like, if they've done well, I might give them an intercurrent dose of what I see as their
Mm,
constitutional remedy, which might be a remedy that is aligned with the bowel nosode. And then when I see them again, if I feel they need the bowel nose again, I'll usually go up to a 200. And then later on, I might go up to a 1M. So yeah, I do use them in higher potencies, but I tend to
very interesting.
step them up. But they're just wonderful remedies and wonderful
Exactly.
for
Yeah.
joints,
Yeah.
but for everything.
I tried to write a book on it some years back, but
Oh,
I'll try to
interesting.
send a copy to you. Of course, your podcast I'm very fond of bowel nosodes, and they are quite interesting. And finally, one last question is about tautopathy and Sarcodes. And for example, of course, we get cases of autoimmune diseases, and very often they are taking steroids or immunosuppressants, and to remove the layer of it, we often use cortisone or adrenal cortex, or for example, if they are taking immunosuppressants, you would give the same allopathic remedy, whatever it is, methotrexate or whatever, in potentized form to remove it. And Sarcodes in that direction. What is your experience with tautopathy in general and in autoimmune cases, and especially Sarcodes?
Okay, well, as I mentioned a little briefly earlier on, I don't very often give drugs back in potency because I'm not sure that, of the provings. I would consider it if somebody has never been well since and I can't remove it. I might consider giving them methotrexate back in potency. It's not that I've never done it, but I quite often use that method for things that do have a proving, like giving cortisol for patients who have been on heavy cortisone therapy, because we do have provings and we can have an idea of what we might expect or what to look for. So giving Sarcodes, I like Sarcodes. I like Sarcodes and Nosodes as well as ordinary remedies, and I use quite a lot of Sarcodes. And I use a lot of, in particular, endocrine Sarcodes, of which cortisol would be one of them.
Yes.
So yeah, I mean, I think
would you use more cortisone, ACTH, or more of adrenal cortex, or all of them?
I use both. I use adrenal cortex often when people have been more on heavy doses of cortisone, like, prednisolone or something. And I use, cortisone back in potency very often if people have had topical steroids for eczema. Need to, but it can be variable. But using Sarcodes is, it's great. And I think a busy practice people will need to draw on, because disease is so complicated these days by, I don't know, electromagnetic energy, vaccines, drugs, toxins, glycophosphates. We need to use all the tools at our disposal. So we need to use the constitutional remedies, the small remedies, the Nosodes, the Sarcodes. We need to have a working knowledge of all of them, I think, in a busy practice nowadays.
Cortisone I use mainly because has many skin symptoms in the provings also. So
Yes.
has more, and adrenal cortex I use more when the mind state of the stimulation and the theme for the kind of need for stimulation is very, very strong. Thrill desire is a very strong pattern that I also use. And yeah.
Yeah. And
And
sometimes
Indian drugs.
Well, the adrenal cortex is useful when people have lived in very, very stressful situations. And they've got that
high stress.
Yes, high
Yeah.
stress. Yeah.
I was coming to, what about Indian drugs? I know that is not very common in Europe. For many homeopaths, very, very rarely use Indian drugs. You know the drugs of Hindustan, like the Azadi Rakta or the Terminalia Arjuna, or do you use them anytime? Any
I have
experiences with
actually.
that?
I studied in Calcutta many years ago with Dr. Banerjee.
Whom did you learn from?
Subrata Banerjee.
Okay, yes.
But
Right.
Dr. Day, Dr. Dubey, many clinics. And so I do use Azidiracta indica and Terminalia tubula and quite a few. I'm not an expert on them. I only know maybe half a dozen of them, but I do use them. And I learned some great tips when I was studying in India.
So cool. Yes. Perfect. So good to know your experiences and inspiring our colleagues. Thank you, Hilery. Thank you.
Thank you for having me. Thank you, everyone, for listening to me. And nice to speak to you. Bye-bye.
Pleasure. Thank you.